Have you ever noticed these little dimples on your chin, like this? They can be really annoying for a lot of people. I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I'm here to explain why you get chin dimples and how to fix it. So let's dive right in. So what is in this area of the chin? Of course, you have skin, and skin can have different degrees of collagen and elastin as you get older. That collagen and elastin starts to decrease about 1% to 2% every year. You have muscles underneath the skin. The major muscle here is called the mentalis muscle, but you also have other muscles called the depressor anguli oris, and even the platysma that's all along the neck overlaps with all these muscles as it goes over the jawline. And then of course you have bone. So why would someone be predisposed to having a dimpled chin? Some of it has to do with how much tone you keep in your chin. Some people just naturally have really tight muscles here, and just doing a little Botox in the surface of those muscle fibers as they're inserting into the dermis or the underneath layers of the skin can relax them enough to kind of break that cycle. A lot of people that have teeth clenching issues or really tight platysmal bands will have excess tension there, and that is a quick and easy fix. But what if it's more complicated than that? What I found is a link between whether you have a recessed chin and chin dimpling. And so what this means is if you've lost bone density in your chin, or if you were born with a chin that's slightly set back, or if you have a natural overbite, that causes these muscles to contract a little more strongly all the time because they're working in overtime to try to close your mouth. And so simply doing a Botox injection can temporarily help, but you're not addressing the underlying cause. And so what I recommend for my patients is a couple of things. So we want to augment the chin to help relax these muscles. You can start by something that is really low commitment, something like filler. I prefer Radius in that area, or calcium hydroxyapatite, because it more mimics bone and it builds collagen over time. So I'll inject Radius into the chin, both in the middle and on the side, to help bring that forward. If you've done that or you want to just go for something more permanent, there are two options. One is a chin implant, and I use a silicone chin implant that I put through an incision in your mouth, so kind of where your gum meets your lower lip. I make an incision through that area. I have to actually divide the mentalis muscle to get to the bone, and the implant sits right on the bone, right at the edge of your chin. And why do I like to go through the mouth instead of underneath here? One is that I haven't found that it increases the chances of infection by going through the mouth. But two is if I don't divide that muscle and repair it in a way that's more accommodating that chin implant, you can have a really deep crease between your lower lip and where that implant is. So I can blunt that crease some by making that incision in the mouth. Now the recovery from a chin implant is pretty straightforward. You may have about a week of swelling. I mean, you technically will have swelling up to about a month, but most people won't notice it about a week. You can have numbness on your chin for several months until all that sensation comes back, because there are two nerves here and here that get stretched in the process of placing that implant. The other thing is the muscle that we have to go through is both swollen and those fibers need to heal. And so temporarily, this mentalis muscle is not going to contract at all when you talk or smile. So you won't realize how much that muscle does until it's not working temporarily. But it does come back and it does start working. All those fibers start firing back. So when I see you around the 3-month mark, you're generally back to your final result, but it does keep changing a little bit over the whole first year. If you don't like the idea of a chin implant, there's one other option, and that's a sliding genioplasty. And that's where I make that same incision, get access to the bone, but instead of placing a chin implant, I actually make a cut in the bone here, slide it forward, and use a titanium plate and some screws to keep it in the right spot. That is something that has a lot more downtime than a chin implant. And so unless you're up for that, I wouldn't recommend it, but you have at least a month where your chin looks really swollen. You don't really want to go out and be social too much. And then you definitely don't see your final result for at least a year. I think it gets better even after that, and you have a higher likelihood of infection just because it is a major surgery. If it were me, I would definitely want a chin implant over a sliding genioplasty, but if you don't like the idea of that, I definitely do both options routinely. There is one particular procedure that can make chin dimpling worse, and that's radiofrequency microneedling if done too deep. I found that if you go beyond 2 millimeters in the chin, if you go 3 millimeters or deeper, one, you're not getting that much benefit from it, but also you can melt some of the fat around those muscle fibers. So where some of the fat would cushion the muscle fibers contracting where they attach to the skin, now you're not having that camouflage. And so I have sometimes seen people that had overly aggressive radiofrequency microneedling treatments like Morpheus 8, Scarlet, Genius. There's many different devices. Anytime you're going too deep on the chin, it can lead to more noticeable dimpling. If you've had long-standing contraction of the muscles around the mouth, the only way to completely fix it is with laser resurfacing. And this is after you've already addressed all the underlying issues of why you have more tension. I will go back in and do a fully ablative laser treatment with a device called the Contour TRL. That is a full field erbium laser that removes the skin cells micron by micron. It's very precise and can really get down to the layer of the skin where we're regenerating new collagen and removing that wrinkle. Fractional lasers, in my opinion, are not the best around the mouth. You're still gonna have some lines. The only way to completely get rid of those lines and nibbles is with a fully ablative laser. If you are interested in treating your dimpled chin, please give us a call. I'd be happy to see you in consultation and discuss what things are unique to you that are contributing to excess chin dimpling, and we can come up with a plan. I am trying extra hard to make more videos just to be helpful for you guys, so don't forget to like this video and subscribe to our channel. I'll be posting every week with helpful information just for you.